Good afternoon, friends, colleagues around the world. We would like to welcome you to our webinar today, Why Pandemics Such as COVID-19 Require a Metropolitan Response, Emerging Evidence from New York, Wuhan, Paris, and Johannesburg. My name is Roger Keil. I'm a professor at the Faculty of Environmental and Urban Change at York University and a co-organizer with Solly Angel of this event today. Before we get into the substance matter of this webinar, I'd like to invite Angela Hawken, the director of the Marin Institute, to say a few words. Angela.
Thank you, Roger. Hello, and a big welcome from the Marin Institute at New York University. In 2015, in a TED Talk, Bill Gates warned us that if anything was going to kill over 10 million people in the next few decades, most likely would be a highly infectious virus rather than a war. Not missiles, but microbes. And he warned then that we weren't ready. Fast forward 5 years, and here we are. Staggering human suffering and economic losses. Happily, effective vaccines will soon be distributed and will snuff out this virus, but there will be others. So we still have much to learn about how best to contain the spread of highly infectious viruses and how to make sure that our government agencies at the city, state, and national levels, and our intergovernmental organizations at the global level, are prepared to respond nimbly and in a coordinated way. The panel today is an important part of that conversation. So a big thank you to our panelists. We look forward to learning from you. And thank you to our participants who are joining us from across the country and around the world. I'll hand back to Roger to introduce our panelists. Thank you.
Thanks very much, Angela, and thanks for hosting this important event. I will now share my screen and say a few words by way of introduction. So the first thing we, I guess, should acknowledge is that this is, in the history of the world, the first urban pandemic. And the question we're asking today is whether that, given that is the first urban pandemic in the history of the world, whether that needs a metropolitan response. We have 5-6 speakers today to give us a preliminary answer to that from various regions around the world. One of the problems that we're facing, in contrast to earlier phases of urbanization, which seem to be more contained and more central, is that while this is the first urban pandemic with a majority of people on the planet now living in something we call cities, it is really a world of extended urbanization, and my colleagues Creighton Conley, Harris Ali, and I have written a paper for a journal called Urban Studies earlier this year, where we discussed this in detail. And that extended form of urbanization, to find urbanization everywhere in various different forms, of course, has an influence on the way we govern ourselves, in the way we govern also pandemic response. It is an unbounded urban world in which we live, but we still live in a world of territorial governance, and we need to think specifically as urbanists, as most of us are, about the bounded forms of territorial decision-making and the governance areas that are related to these jurisdictional areas that we live in or that we need to invent. We can see that over the past 20 years that we have started to think of ourselves living in one urban world. We had a preliminary warning in 2003 through the SARS epidemic, which at that time my colleague Harris Ali and I worked on, and we thought that this pandemic exposed the exoskeleton, the outside skeleton of the global economy, and connected the world cities, the global cities, the major financial centers in East Asia, but also North America. Toronto was particularly affected. But if we look and fast forward to 2020, the COVID-19 pandemic exposed the flesh and bones, not the exoskeleton of global capitalism. I like this quote by a Chinese journalist who wrote, "Wuhan is one of the newly discovered inner lands of the global production chain as the Chinese coasts have become more expensive." So we now are in a world that is one in which there is no outside. We're all in this together, at least in this way. This is also now pointing clearly at the fact that politics of the pandemic is the politics of everything. It's very hard. We now see government governance, governmentality, politics in times of the pandemic really covering everything. And it is particularly, and that goes back to the history of research and scholarship on the governance of disease, of course, the biopolitical and the necropolitical forms of governance that we need to particularly be concerned about. This is the kind of politics that deals with life and with death. And the question is, to what degree do we need a metropolitan response in that context? At a very high level of abstraction and historical perspective, we can look back to scholarship just like Philippe Sarrazin's, the Swiss historian, on Foucault's ideas about how we in modern societies developed different forms of governance, of politics related to institutions that were invented with regards to particular outbreaks, leprosy, plague, smallpox. And we can summarize it in our cities today. With COVID-19, we've seen a mix of models and popular reactions to those models: lockdowns, isolation, quarantine, vaccines, social distancing, living with a disease, and so on. All of those are in play. What of those, what specifically needs to be dealt with at the metropolitan level is something we want to ask today. This also needs to be seen in the context of global urban governance, pandemic governance in particular. SARS was called by David Fidler the first post-Westphalian pathogen. At the time, he assumed that cities would play a bigger role in urban regions, would play a bigger role in global governance of pandemics. He revised his own prediction early in the COVID-19 pandemic and started calling COVID-19 a Westphalian virus, which is linked to this, of course, the beginning of the virus control governance in the spring, where China and the United States in particular created national responses that were quite different, as we know. But we also need to point out that the WHO that created the international health regulations, which were just being drafted as SARS occurred in 2005, then later on doubled down by creating a document called Cities and Public Health Crises in 2009, which is a feeble attempt to bring governance, global urban governance, to their attention. Now, the metropolis is always in the middle of all of these conflicts. There are central or federal, local conflicts. There's conflicts of external urbanization itself, city or center periphery conflicts. There are regional conflicts, jurisdictional overlap. You see this map of Toronto in the upper left corner here. That neat line, of course, is just a fantasy because Toronto ends there jurisdictionally, but of course not in real terms. There are streets connecting to the outer suburbs there. Intra-city issues, hotspots of poverty, racialized neighborhoods, but also on the positive side, we have seen community-based responses. Here the example is the quite successful Ebola response in West Africa and the DRC that we've seen over the past few years. There are diverging models, and here you see a map of Milan, which really shows very clearly that it's hard to contain the virus in a particular part of each city. We are currently involved in some research on Toronto, Berlin, Milan in a comparative way, and I can't go into detail. I just want to point out these are diverging models. It's a world of difference that we live in, very complex and complicated, much for us to think about. Regions themselves and institutional actors have begun to react to those challenges individuals that we all know very well have begun to write about it in the way that they have seen this coming, in the way they have been reacting to it. The ways forward are complicated, but our hope is that through this panel and through our research collective work, we can begin to see COVID-19 and whatever is going to come, as Angela said, down the pipeline through an urban lens, because much as they affect the body, pandemics affect the body politics, says Simon Lucen, and we can say now that now more than ever that body politic is the city or the metropolitan region. Our panel today is here. I will introduce them all individually, and we'll start to introduce my co-organizer, Shlomo Angel, Solly Angel, who is a professor of city planning at the Meron Institute. He leads the NYU Urban Expansion based at the Meron Institute and the NYU Stern Urbanization Project. Solly is an expert on urban development policy, having advised the United Nations, the World Bank, and the Inter-American Development Bank. He currently focuses on documenting and planning for urban expansion in the developing world. Solly is a leading voice globally in our understanding of patterns of extended urbanization worldwide, and has been a major inspiration to our global suburbanisms project and my own work. I am delighted that he invited me to join him in co-organizing this panel. Solly.
Thank you, Roger, for the kind introduction. In my presentation, I will focus first on the New York metropolitan area, and then on evidence from the US that supports the contention that pandemics such as COVID-19 require a metropolitan response. The New York metropolitan area is the largest metropolitan agglomeration in the United States. In 2018, it had a population of 20.1 million and a gross domestic product of $1.72 trillion. In theory, we expect larger metropolitan areas like New York to have more COVID-19 cases and deaths per capita than smaller ones because they are more interconnected. As cities grow in population, the number of possible interconnections grows by the square of that population. More people can and do meet more people. This is what makes larger cities more susceptible to pandemics, but it is also what makes them more productive. In fact, as our colleague Alain Berthaud has convincingly argued, cities are labor markets where workers have access to all jobs and workplaces have access to all workers. What makes New York more productive than smaller cities and towns is a better fit of workers to jobs, more specialization, more creative interactions, more opportunities, more resilience to industry shocks, and of course, larger markets that allow for large economies of scale. What you see here is a small sample of commuting trips in the New York metropolitan area. We can see clearly that people live everywhere and work everywhere. The next slide shows the same pattern in the Chicago and Atlanta metropolitan areas. Even though these three are enormous metropolitan areas, each one forms a single metropolitan labor market. These large metropolitan areas are also key nodes in global networks, as well as gateways for international travel. This slide shows the number of international destinations in US cities as a function of population size. New York is on the top right. This, of course, also makes New York a wide gateway for pandemics, as well as the avant-garde of pandemics. The COVID-19 pandemic hit the New York metropolitan area early, and it hit it hard. Its response to the pandemic has been difficult, not least because it is so large and so fragmented. It sprawls over 4 states and is comprised of no less than 24 counties and 447 municipalities. In fact, The New York metropolitan area contains 65% of the population of New York State, 75% of New Jersey, 26% of Connecticut, and 0.4% of Pennsylvania as well. COVID-19 deaths climbed to a high peak in the New York metropolitan area early in the pandemic and declined rapidly early in the pandemic as well. This rapid rise and fall was much more acute than in the remaining areas in the 4 states of which it is a part. It is in this connection that we need to ask, what is the appropriate spatial scale for the governance of pandemics? It is now in the hands of states from above and counties and municipalities from below. In the US at the present time, there is no public health institution to monitor and manage the pandemic at the metropolitan scale. The governor of New York State, Andrew Cuomo, having done his best to coordinate relevant responses to the pandemic with his fellow governors, admitted that state-mandated travel restrictions, for example, restricting entry to New York State and requiring a quarantine of all out-of-state visitors, are unworkable when one recognizes the interconnectedness of the New York metropolitan labor market. It is also important to note here that one of the key features of the current pandemic is that it hits poorer neighborhoods much harder than rich ones. As we clearly see here, in New York City, there are poor counties and rich counties within the 5-county New York City, rather than poor neighborhoods within these counties. To the extent that it is associated with place, inequality is a metropolitan issue, not a municipal issue. And we can see it even more clearly in Chicago and Atlanta. There are high and low income counties rather than neighborhoods. This tells us that the governance of pandemics, if it is to be inclusive and equitable as well as effective, must be at the metropolitan level rather than at the county or the municipal level. Moving on, I want to examine a question raised by Victor Rodwin. When it comes to pandemics such as COVID-19, do large metropolitan areas pay a public health cost because of their large number of interconnections, or do they gain a public health advantage because of the high concentration of human, political, fiscal, and financial capital? The answer to this question is not obvious. In theory, it can go either way, and this is why evidence matters. To employ evidence to answer this question, Alex and I looked at daily COVID-19 data on cases and deaths for all 3,412 counties in the US from the 21st of January to the 27th of September. We divided counties into 3 categories. 1, multi-county metropolitan statistical areas. 2, small city counties, including single county MSAs and micropolitan areas with cities of less than 50,000, and 3, rural counties. Our objective was to test the public health cost thesis. To that end, we posited 4 hypotheses: the onset hypothesis, the peak hypothesis, the scaling hypothesis, and the neighbor hypothesis. Because of the shortage of time, I will skip the report on the peak hypothesis. The results there are similar to the results for the other hypotheses. The onset hypothesis posits that the onset of COVID-19 cases and deaths commenced earlier in multi-county metropolitan areas than in small city counties, and earlier in small city counties than in rural ones. The scaling hypothesis posits that multi-county metropolitan areas had more COVID-19 cases and deaths per 100,000 than small city counties and rural counties. The neighbor hypothesis posits that levels of COVID-19 cases and deaths in counties within multi-county metropolitan areas were more strongly related to respective levels in their neighboring counties than small city counties or rural counties. We tested these hypotheses by comparing the average values and their 95% confidence level in the 3 categories of counties identified earlier. In the remainder of my presentation, I shall report on these results. The onset of COVID-19 cases, for example, commenced on average on the 20th of March, 2020 in multi-county metropolitan areas, significantly earlier than in small city counties, the 26th of March, and much earlier than in rural counties, the 16th of April. The onset of COVID-19 deaths commenced on average on the 24th of April in multi-county metropolitan areas, significantly earlier than in small city counties, which was the 10th of May, and much earlier than in rural counties, the 19th of June. In terms of the onset of the COVID-19 pandemic and its early peak, larger US metropolitan areas had to pay a higher public health cost than smaller cities and rural areas because they were largely caught unprepared. As the pandemic progressed, larger metropolitan areas were able to benefit from their public health advantage. This can be seen clearly when we focus on the scaling hypothesis. The left graph shows that the observed shares of cases across the three categories were different from a scenario where cases would be proportional to the actual population of each category. The difference was significantly higher in multi-county metropolitan areas early in the pandemic on the 27th of March, but no longer significantly higher than in small city counties by the 27th of June. The right graph shows the same finding for COVID-19 deaths. Values are still significantly higher, namely the number of cases per 100,000 people, of deaths per 100,000 people, significantly higher in larger metropolitan areas. And as larger cities assert themselves, the differences become much smaller. Finally, we turn our attention to the neighbor hypothesis. This hypothesis asserts that counties in large multi-county metropolitan areas are more interconnected with their neighboring counties than small city counties or rural counties. If that is the case, then we should expect the onset dates of COVID-19 cases and deaths to be closer to those of their neighbors, and the cumulative number of cases to be closer to those of their neighbors as well. In this slide, we see on the left that the average absolute difference in the onset dates between counties and multi-county MSAs and their neighbors is significantly smaller than the difference in smaller city counties or in rural counties. On the right, we observe the same results for the onsets of deaths. And in this final slide, we see that the average absolute difference in the cumulative number of cases between counties and their neighbors in multi-county MSAs, again, is significantly smaller than in small city counties or in rural counties. And on the right, we observe the same results for the cumulative number of deaths by that day. This brings my presentation to a close. I conclude by noting that the evidence for COVID-19 cases and deaths in US counties in the first 7 months of the pandemic makes it difficult to reject the hypothesis claiming that multi-county MSAs incurred higher public health costs, at least in the initial months of the pandemic, that counties within them are more interconnected, making them more vulnerable to pandemics, and that inequities in public health are metropolitan in scale. Given the evidence, I must conclude that large metropolitan areas can benefit from institutional arrangements at the metropolitan scale that can both monitor and manage pandemics. Thank you.
Thank you very much, Solly. We're moving across the country now, but actually across the world. And I'm going to introduce Xu-Fei Ren, our next speaker, who is a professor of sociology and global urban studies at Michigan State University. She comes to us from Chicago today. Her research focuses on urban governance, architecture, and the built environment in global perspective. She's the author of Governing the Urban in China and India, Land Grab, Slum Clearance, and the War on Air Pollution, Princeton 2020, Urban China, Polity 2013, and Building Globalization, Transnational Architecture, Production in Urban China, University of Chicago Press 2011. Xu-Fei is also the co-editor with myself, full disclosure, of the Globalizing Cities Reader, and one of the earliest scholarly commentators on the pandemic in 2020 when it unfolded in late winter in Wuhan. And Wuhan is what Shufei will speak about, to us about today. Shufei.
Hey, well, thank you for the introduction, and also thank you for organizing the panel. I don't have any slides today, so I'm just going to talk for no more than 10 minutes. So Wuhan was the first epicenter of the pandemic, but in the last few months, the city has largely contained the spread of the virus. Life is back to normal for most residents. And in fact, most people, local people, have even stopped talking about the pandemic. So the buzzword today in the city of Wuhan is post-pandemic. In Chinese, it's 以后. So in the local media, you see post-pandemic, that word very often these days. So today I'm going to just share with you some of the examples of what the Metropolitan government has done to contain the spread of the virus. So perhaps very different from other cities discussed on this panel, Wuhan does have a consolidated and very powerful metropolitan government. The whole metropolitan region has about 20 million people and 11 million in the central urban districts. In terms of the size, it's about the same as Chicago metropolitan region, about 8,000 square miles, yes. So, but very different from most metropolitan regions in the US. In Wuhan, there's only one single authority in charge, that is Wuhan municipal government. So in the last few months, the city, municipality, the municipal government has done a number of things to contain the epidemic. And I'm going to just talk about a few examples. The first very aggressive action taken by the municipal government is the lockdown. It was announced on January 23rd, and it lasted for 76 days. Everybody in China knows the number because the lockdown was so strict, so people basically were not allowed to go out of their apartments. They couldn't even go out to get food. So they ordered food online, and that food was delivered to their tiny apartments. The lockdown was lifted on April the 8th, and everybody in the city was celebrating that it's over. It's very traumatic, very difficult, but there are recent new research shows that the lockdown did help to break the local transmission chains. So that's a very aggressive intervention. It's highly controversial. A lot of people didn't like it, but it did help to stop the virus from spreading in the first early phase of the pandemic. And that the lockdown Wuhan did probably is not possible for other cities. It was implemented in the entire metropolitan region. So for almost 20 million people, it's possible only because there's just one single authority in charge, Wuhan metropolitan government. So that's my first example. The second example is neighborhood surveillance system. So at least in urban areas, the city implemented, in Chinese, it's called grid governance system. So basically the metropolitan government divided the entire territory into many small cells, and each cell is called a grid. In Chinese, it's called 网格. And for each cell, it's about 1 square kilometer, and it has probably a few hundred households. So for each small cell, there are many people appointed by the city and also lower level district governments to work as volunteers to be responsible for contact tracing and also quarantine. If they find infected people, then they would take people away from their homes and then send them to different shelters for quarantine. And these volunteers were not paid for their job. Probably many of them didn't want to volunteer, but they were appointed by the city government to take charge of contact tracing and also surveillance at the neighborhood level. And that was highly effective and also very controversial. There was a lot of conflicts, even fights between the residents and the volunteers. So that's another example of what a consolidated and very powerful metropolitan government can do. And after the pandemic was over, I mean, in terms of the very low number of new infections. So that happened around mid-April. So around probably late March, the city implemented technology-based surveillance system. It's called the Municipal Health Code. It's basically an app people install in their phone. And so people are required to enter a lot of personal information and also travel history, also who they have been in contact with. So a lot of personal information they need to enter in that app. And then there are three, then they need to show a barcode. There are three colors, red, yellow, and green. If they enter the red information, everything is red, then the barcode turns green. With the green barcode, people can go outside to go get food, go to restaurants, and take public transportation. If their barcode is yellow, they will not be allowed to enter public places. And if the barcode is red, I think they will get a call right away from one of the local authorities. So that's how the municipal health code works. It's again, it's very controversial because it takes a lot of personal information, and the government has all the information from almost every resident. But without the barcode, people just can't go out. So there's no choice. So this is another example of what a powerful metropolitan government can do. Then I also want to share with you maybe a counter example of how things can go very wrong when there's so much power concentrated in one single authority. So if we look at the very early phase of the pandemic, late December and early January, Wuhan was in chaos, complete chaos, because the local officials were very afraid. They didn't want to look bad, make their city look bad, make themselves look bad. So local officials, including the mayor and also the city's party secretary, tried to cover up the outbreak. And when they reached a point when they could no longer cover up what was going on, they significantly underreported the cases, both infections and also the deaths. So by doing that, they sent a very misleading, wrong message to the rest of the country that the virus was probably not that serious. So that's a perfect example of how things can go wrong when you have just one single very powerful metropolitan government, and then there are no checks and balances. And these local officials elected, they are not accountable for local residents. So to conclude, I want to just revisit the question for the theme of the panel, which is metropolitans. I don't think there's a simple answer, a yes or no answer, whether it's good or bad to have a powerful metropolitan government in terms of infectious disease control. I think the answer is more nuanced and mixed, and the Wuhan example precisely shows that it can be very effective, but if there's no transparency in decision making, also in information disclosure, then a lot of things can go very wrong. So I'm going to stop here and thank you for listening.
Thanks very much, Shufei. We're now moving on to our next speaker, which is Eric Oebrechts, who is a senior architect and urban planner. An urban planner, a member of ISOCAR, ICOMOS, Société Française des Urbanistes, and an officer of the Royal Order of Sahamet-Tere, which is the Kingdom of Cambodia. He is the manager of international affairs at the Directorate General of the Institut Paris Région. He has developed a large experience in the field of urban and regional planning as expert and team leader on Algiers, Bangalore, Beirut, Cairo, Damascus, Dubai, Ethiopia, Istanbul, Kampala, India, Mongolia, Mumbai, Paris, Ile-de-France, Phnom Penh, Rio de Janeiro, Samarkand, Saudi Arabia, Tripoli, and Al-Ula. He has prepared projects at local, sub-metropolitan, metropolitan, regional, and national scales. He also has academic experience as the director of scientific research in the Middle East and as a lecturer in several universities in France and abroad, mainly on territorial planning in the Global South. Eric.
Is it okay for the screen? To see my screen?
You can see the screen, yes. Thank you.
Okay, so I will speak about Paris region, Paris metropolis. So the first question regarding the metropolitan area, it is what is a metropolitan area? What is the metropolis? And there are several definitions. Generally, it's a little bit blurred because problem of data. Here you have on this map, you have the functional urban area of Paris, which is touching other functional urban areas, with the dense area in red, and in orange it is the functional urban area. And you have the dark line here is the region. So you see we have no real jurisdiction that is fitting completely with the metropolitan area. So this is one of the question. The region is 12 million. The functional urban area is 13 million. The urban agglomeration, the dense area, is 10 million or 11 million. Greater Paris, we'll see just afterwards, is some 7 million. So we have different jurisdiction and different actors from the public body, but also the private. But the public body, we have 7 tiers: Europe, France, region, department, intermunicipalities, Greater Paris, and 1,268 municipalities. So we can consider are probably the worst in the world. So we are looking for a lot of strategies to put around the table all the actors between the different tiers and the different territories. And regarding the metropolitan area, here you have a metropolitan forum, you have a platform for discussion to define the vision, the objective for the future and the management of the metropolitan area. It's not covering all the area. If we think about, we create the metropolis of Greater Paris, but it is covering only 5% of the FUA, the functional urban area, but accommodate 7 million inhabitants, so a little bit more than half of the population of the functional urban area. So you see, and we'll see that everywhere, the relation between the institution that is managing the metropolitan area, in fact, it is more the region than Greater Paris now. Here in Paris, we have a big conflict between the 2 scales, but it's never fitting with the metropolis itself. And so we have a functional system, which is the metropolis, and we have the institutional system, which is much more complicated and try to do something with the reality of the life of people and the economy. We have also a union of municipalities, about 60 union of municipalities in the region. And so we try to find a way to connect all of them with the region, with the department, with the Greater Paris, and with municipalities. So there is a share of competencies at the local level, which is there is a lot of overlapping between the region, department, inter-municipalities, and community municipalities. And so for transportation, for housing, for environment, for solid waste, for tourism, we have a lot of overlapping. So this push all the different tiers to discuss with others. So it is very good for democracy and for representation of the population and the different interests. But also it's more complicated to take the decision, of course. So now we go back to the COVID. This is our context for the how to manage the metropolitan area. It's not easy. In fact, the COVID was managed by the President of the Republic directly and with the government, the national government. And when there was initiative taken at the local level, it was very complicated because they have to be aligned with the decision made by the national government. So we have in Paris region, we have more than 11,000 deaths. We have at the beginning of the crisis and in the first wave, we had 2 times in proportion of the population, 2 times people dead people. Now in the second wave, we have quasi the same level than the rest of France from the number of affected people with the test and the number of deaths. So probably we can consider that the metropolitan area are more affected at the beginning of the pandemic because they are more interconnected. But after that, when it is spread out in the country, we have the same level of proportion of population dead and proportion of population with affected by the virus. So we have to continue to observe this pandemic, but probably we said at the beginning that the metropolitan area are more affected. That was the case at the beginning, but at the end, it's not sure that it is the case. So the region took some initiative. They bought 5 million masks in coordination with the government. Municipalities continue to manage local public services. They provide the local police when they have in 230 municipalities. And so there was some kind of coordination, but it was managed mainly by the national government. These are the figures of last week in Paris region, covering all the crisis. So you see the peak at the beginning, and the second wave is there. So now we are at the end of the second wave. So it's reducing very quickly. Of course, it's more the elderly is more affected. And we have, but yes, we can say that what I said, the positive test is 13% at the national level today, and in Paris region is 12.9. So it's quasi similar. It is similar. The COVID region, like in New York, we had already some discussion with the RPA about that, affect more the location where there are vulnerable people, poor people. It's interesting to see that it is more where there is poor people than rich people. But rich people there is more elderly here, but the most affected are in the northern part, in Saint-Denis, etc. Here we have by commune, here by intermunicipal union of municipalities. So this is the same observation in New York. We did some a survey at the end of the first wave to see how the people were affected. We did a lot of chronicle, but also we said that there is. We asked them what is changing for your life for the future. regarding the teleworking, regarding the telemedicine, regarding education, regarding mobility, of course. And so it was a big change during the crisis because teleworking increased from 19% to 39% in a few days. So this was huge, but now people are saying, and a lot of people working in the offices, they said they want to continue for 2 or 3 days a week in teleworking, but they want to go back to the office to have social communication with their colleagues. This is very important, and the teleworking is not enough for that. So the teleworking for here for telemedicine or for mobility, a lot of people say they want to, they will change their way of life. They will, they want to have more greenery, more fresh air, less crowding in the public transportation. And so there is a big question about the change of residential mobility for the future. If there is a change in the organization of the firm, if people can work only 2 days in their office and 3 days in their home by teleworking, probably this can affect a lot of things in the behavior of the population, and this will affect the shape of cities and the shape of public transportation. In Paris, like in New York, like in other cities, like in London and Dubai, etc., we have a big drop in the use of public transportation. So it was about 70% during the first wave. Now it's about 50%. And when they between the two waves, we didn't recover the same level than last year, and so people are already changed their habits. They use more bicycle for different things, but they don't want to go back in crowded public transportation like before. So this creates a big crisis, financial crisis for public transportation. So this is a big concern, and probably in cities there will be some change in the financing of mass transit with tools less heavy, like less train and more tramway, more BRT. So this will change a lot of things. But if we think about the economy itself, Paris was really affected, impacted by the crisis, because Paris is the first touristic city in the world with 50 million tourists a year, and culture is touching 9% of the jobs in Paris. And and they are really affected by the crisis. So the statutes are very fragile, and they're very, very vulnerable. There are some help from the government, but in fact, this part of the economy, restaurant, but culture out of the restoration and transportation, but culture is really affected. And this will change in the competition between cities. Our GDP will be more affected than other cities because of tourism. So in that competition, we have to change our mindset. We are a very diverse city. We are a very global and economy in our city, but and so we can face the crisis, but we are more affected than the other cities. We can say also that the finance economy, generally, we see in the different crises before that finance economy increase because of the debt increase, the public debt, and sometimes the private debt increase, the global money increase. And so, and at the end, this money go back to the stock exchange market, and and the investors put about 9 to 10% of their investment in real estate in cities. So we don't know with the change in the real estate what will happen, if they will continue to invest in offices, in the city centers, in the CBDs, new towns, etc. But probably if we have the same pattern, this will continue to affect cities and to create more empty apartments in cities. Why empty apartments? To have liquidity with these apartments, like asset in the stock exchange market. So just in the last 5 years in the city of Paris, we had an increase from 14% to 17.5% in 5 years of empty apartments. So we have about more than 220,000 empty apartments. We have 6,000 people living in the street, and we have no solution for them. Okay, I go very fast. So in 2-3 minutes, we're reshaping cities by mobility systems. So the crisis was the opportunity to continue with the project of Metro, but to speed up with the highways of cycling of Polybero with 650 kilometers. So this I will go very fast. So we are reshaping city by a more polycentric, that is in the same way that we want to have more greeneries, we need to have a more polycentric metropolis. So we'll continue with that. Green planning, of course. The crisis was, as we said just before, an occasion to speed up the digital transformation of cities. It was not so obvious before, now it is obvious for everybody. So the question of the eradication of the economy inside the metropolis to reduce the globalization. So this is one of the discussion that we had, but also to have local production and to have local circular metabolism better than to have take too much energy and others. And my two last slides are regarding governing the megapolis or the metropolis. We are in the age to change, to have a new step in our governance system, which is very complex and inefficient today, and to merge the Greater Paris and the region at the scale of the region. And so to give more power to the municipalities inside the regional level. And so the end is to finish with territorial planning agencies, which is a support to the metropolitan area to feed the public debate with knowledge and with strategies and policies, to produce these policies at the, and so it's very important to have this agility, this flexible platform to support the public debate permanently and to feed the development of metropolis for the crisis, because we are going from crisis to crisis. We should be more flexible, and for that we should have some flexible tools. Thank you very much.
Thank you, Eric. I would like to remind the audience that we will, if time allows, take questions later in the Q&A. And if you do have questions, if you could please ask them in the Q&A function on your screen, and we will collect them, and I, as the moderator, will forward them to our panelists later on. But now we're going to stay on the other side from my point of view, because I'm in Toronto, of the Atlantic, and we're going to Johannesburg. Our next speaker is Margot Rubin, who is an associate professor and senior researcher in the South African Research Chair in Spatial Analysis and City Planning, in the School of Architecture and Planning, in the Faculty of Engineering and the Built Environment at the University of the Witwatersrand in Johannesburg. Since 2002, she has worked as a researcher and policy and development consultant, focusing on housing and urban development issues, and has contributed to a number of research reports on behalf of the National Department of Housing, the Johannesburg Development Agency, SRK Engineering, the World Bank, Ekurhuleni Metropolitan Municipality, and Urban Landmark. Her well-timed, co-edited book, Densifying the City, Global Cases in Johannesburg, has just been published by Edward Elgar last month. And I should also mention that Margot is, with her colleague Phil Harrison at WITS, is part of a network of scholars in the BRICS countries who deal with exactly the topic we are talking about today. And that contextualizes, I believe, Margot's presentation today. Margot.
Super, thank you so much, Roger. Let me just share my screen. Okay. Not sure why it started there, but never mind. Okay. Great, thank you very much. I'm going to be talking about the Gauteng city region, which is where Johannesburg is located in, very much from the perspective of what we're talking about here, thinking through the notion of what metropolitan governance is, what metropolitan government might look like. So just to give you some quick context, the Gauteng city region is an integrated cluster of cities and towns around the main node or the main heartland of the Gauteng province itself, which is, let me use my cursor, if this is South Africa, Gauteng is this teeny tiny little province over here. It's made up of 3 large metropolitan municipalities and a number of smaller municipalities over there. So it's made up of the city of Tshwane, where our capital city Pretoria is, Ekurhuleni, which is just to the east, it's an old industrial manufacturing sector, and the city of Johannesburg right here in the center, and then smaller municipalities down the side. But the actual city region itself extends far beyond the kind of provincial boundaries and into other provincial, what you might call state areas, across the provincial boundaries and into other municipalities and areas. And this is largely, as Sally and others were talking about, speaks to the kind of functional nature and the functionality of the city region itself. According to, just to give you some very basic insights, according to the mid-year estimates from this year, the city region is about 15 million people, which constitutes more or less about 26% of the South African population, right, concentrated in what is effectively something tiny like 4 or 5% of the land within the South African Republic. Great. Okay, just to give you some idea as well, I mean, this is the area we're talking about. You can see it's the densest, most populated area of the country. You can see these small satellite nodes all around it. It is also, just to give you some idea, it contributes hugely to the South African economy. It's about 36% of GDP, mostly in the tertiarized sectors of finance, real estate, business, and a huge amounts of general government services sit within this province itself. And that's really its contribution, where its contribution stems from. But it is not evenly distributed. And as most people already know, that South Africa is one of the most unequal countries in the world, and Gauteng is one of the most unequal provinces, and Johannesburg one of the most unequal cities in the world. And this is very much spatially aggregated, as you can see. So if you look at the way that the city region or the actual province is structured, the wealth is very centrally located within what is called the financial center of Sandton. This kind of and Rosebank. It's a kind of corridor and series of nodes right in the center. And then as you move toward the peripheries, there's less and less of a GDP kind of contribution and less a contribution. This is, of course, where poorer people also start to live, which is on these peripheries. And this is largely due to the apartheid geographies, which are still very much in evidence around South Africa and cities today, and certainly the case within the city region as well. So highly unequal, and you start to see scenes like this kind of these are informal settlements, slums within old warehouses. You see lots of informality, people working in all kinds of terrible jobs, but at the same time, you also see huge skylines, multi-story skyscrapers, and luxury homes. And this is the discrepancy that exists very clearly within our society and spatialized, as I showed you, between the center, which holds most of the wealth, and the periphery, where most people live in slums, in informal settlements, and in what are called old townships, apartheid townships. So that's still very much in evidence. So, but today we're talking very specifically about COVID. And just to give you some idea that in terms of the COVID crisis itself, in terms of the pandemic, we've had somewhere in the region of about 796,000 cases across the country over the period. Gauteng has borne the brunt of that with about 235,000 cases, 36,000 cases, compared to, which is basically almost double even the highest numbers of anywhere else across the country itself. If you can see, this is the change per day, peaking very much within the July kind of August periods, and then tailing off towards September, quite a steep drop. And now moving into December, we think we're beginning our second peak. This is the assumption. And nationally, we had about 4,000 cases yesterday. So we're beginning to worry a little bit about where we're heading into, and that's mostly located not in Gauteng, but in two of the other provinces across the country. but you just get some idea of our kind of infection rates that did occur. This is a heat map, and basically it indicates where we've had the most number of cases across the city region, with the red, of course, being the highest numbers, and the kind of light blue being the fewest, dark blue being the fewest. And what's interesting about that is, although there are clusters where you see some of the poorest populations and some of the densest populations, it has not necessarily tracked completely according to where we see large numbers of informal settlements and high numbers of poverty. So it has not been a direct correlation that we've noticed between COVID and density, and COVID and poverty, which is actually really, really interesting, particularly compared to some of the other things that we've been shown over the last few presentations. Okay, so what were our responses? Well, like Wuhan, we had an extremely hectic lockdown during the first period from 27th of March. And it was one of the hardest lockdowns we've seen. People couldn't leave their homes. There was a curfew. There was no sale of alcohol, no sale of cigarettes. All the schools were closed, all the universities. We couldn't even take walks or exercise out of our front door. So in many ways, it kind of reflected on the Wuhan model that we've seen, the kind of Chinese model. And at the same time, in terms of governance, what happened was that there was an establishment of national, provincial, and local corona command councils, which were used to really to think about how to govern the pandemic, how to control it, and these filtered down into command centers and disaster operations centers, and these were established very specifically for the governance of COVID. But at the same time, there was also the use of a series of existing institutions and organizations. So in addition to the command councils, which later became known as the war rooms, we also used the Presidential Coordinating Council, which had members of the ministers and members of the Executive Council, the National Joint Operational Intelligence Structure, which controls security, and the National Defence Force, so that became quite important, and then the District Development Model, which is a horizontal organization dealing with how municipalities engage with each other. All of these were used, and in some very confusing and not necessarily very coordinated ways, to think about how to govern and take control of what was happening within the country over this period. So why metropolitan governance? Well, this is a difficult question, because in some ways I'm going to be answering this question based on what has happened around effectively provincial governance, and how many of these functions were taken up and taken control over by the provincial government, because we don't actually have, unlike Ile-de-France or many other places, we don't necessarily have a metropolitan level of governance. We don't have anything that's governing the Gauteng city region. So the closest thing that we do have is our kind of provincial government, which tries in some ways and thinks of itself as governing the city region, but has jurisdictional kind of boundaries around it. So why metropolitan governance? Well, there are a whole heap of functions that sit already at the provincial level. All the health functions, all the hospitals, the human settlements function, transport and education already sit at an institutional level within the provincial government. There's a huge, massive administrative infrastructure that was already in place to take control of these things when the pandemic hit. They've got a strong link to national government, much stronger in some ways than the kind of smaller municipalities to national government, and they tend to have larger budgets in some ways. So for those kinds of reasons, we began to see that this may make sense as an area, as a sphere of government, to take care of what was going on. Also, we need to think about how functionally connected this whole region is, and as a consequence, that there are a whole lot of coordination efforts that need to be considered when thinking about the kind of metropolitan scale, thinking about thinking about what was happening with the pandemic. And what we did see, and some of the things that I would really reiterate, is that the provincial government was able to coordinate humanitarian relief efforts. They brought partners together. They brought municipal officials together with a whole lot of state and non-state actors. So they were really integral in that kind of thing. They offered leadership and direction, and they often stepped in when municipalities right across the country, but also within the province, lacked capacity, and that became a really key issue. And it also became in this situation where through the structures that I described to you before, which were often cross-cutting kind of transversal structures, the top level decision makers from different spheres were able to sit together, they were able to collaborate, they were able to think through what the issues were, they were able to come up with coordinated responses. And as a consequence, they were able to think across boundaries and think about how to align activities and how to align their work right across the different boundaries, both municipal boundaries, and then thinking across how to coordinate across the provincial boundaries, which had really been part of their thinking for a long time within the kind of notion of the Gauteng city region. And what we also saw is that by putting these structures in place, by having these metropolitan structures in place and having all of these leaders together, and they were meeting 2, 3, 4 times a week on these different platforms, you really did have an ability to make on-the-spot decisions, give them immediate effect, put budget to them, and off they went. And so they also became spaces of innovation, which is quite interesting. And at the same time, you know, we have a situation where across the municipalities, there's a whole array of different kinds of government agencies. Each municipality has its own road agency, has its own development agency, has its own whatever. So they act very much in a kind of parochial way, dealing with their own parochial issues. At the same time, some of the metros, some of the municipalities were in pretty poor shape prior to the pandemic. Tshwane, which is Pretoria, the country's capital, had been placed under administration just before the pandemic hit. They were in a financial crisis. There'd been about 6.9 billion rand in unauthorized and fruitless and wasteful expenditure. So they're really in poor shape. And then during the actual crisis, they were asked to take on a whole bunch of roles that they had no experience in at all. Disinfection of communal facilities, community health screening, testing, tracing, all kinds of things that they had had no experience in at all. Whereas we had actually more experience, or the Metropolitan government had had more experience, largely due to the previous AIDS pandemic. So there was some experience there in dealing with the pandemics that did exist within the Metropolitan government. But having gone this route where we start to think about how these responsibilities were shifted, it also showed us where the fault lines existed within government and within a whole range of different aspects. So within intergovernmental relations, we started to see some serious breakdowns in the kind of vertical relationships between local or municipal, provincial and national government, which has always been a problem. It's been a problem, as you can see from the quote, since early on, since 2012. And so this continued in a lot of ways. There was a poor flow of information, and there was a serious lack of trust between the different spheres of government. In Gauteng, this was because there was in some cases, there were different parties leading the different municipalities and metros, and in other cases, because of the internecine kind of intra-party squabbles that have been going on within the African National Congress at the moment. So what we started to see within the structure of what was going on is that there had been, and there continued to be, real issues around government relations and intergovernment relations. There were very questionable disaster management preparedness right across the province. The provincial structures did seem slightly better prepared than the municipal structures, but nobody had anticipated, despite Bill Gates' wonderful speech a few years ago, nobody had anticipated the idea of a pandemic. And also, there was very inadequate healthcare. So although it's a great idea to have the metropolitan function, our healthcare facilities have been failing for a number of years. There are all kinds of problems in terms of the number of vacant posts, the lack of equipment, the lack of drugs. And so when the pandemic hit, what became even more apparent, something we'd already known, is that the health facilities were not able to take care of these situations. They had never been, and they were certainly not going to be able to take care of it now. And so we had to put in place a whole lot of field hospitals and all kinds of things very, very quickly, and some of which we did. But there was also some issues that did come out as a consequence of metropolitan government having, or provincial government having, such strong authority. And something that Professor Wren mentioned, which kind of resonates with our own situation, was because there were such strong links between national and provincial government, it seriously allowed certain elements within the state to pursue their own agenda. And what had happened is that the provincial health department was hoarding data. It was not sharing its information around where hotspots were happening. It wasn't sharing its information about where necessarily there were the worst cases. And there is a sense that in some cases there was a falsification of data to make it look as if the highest rates of infection and the highest death rates were in the informal settlements. Now, this was simply not the case, but it was certainly made to appear this way. And the consequence was that the National Department of Human Settlements were then able to pursue their own agenda through their Minister Sisulu, which was to get rid of informal settlements, to try and relocate people, to try and so-called de-densify the informal settlements based on this idea. Similarly, there was an idea, the same way was the idea to deal with taxi. Sorry, that's Minister Sisulu with her finger up, laying down the law about de-densification. But similarly, there was the idea of trying to get rid of the taxi problem by taking control of the taxi industry, which has been notoriously ungovernable, and trying to show that there had been high incidences of infection in public transport. The reality is we didn't have that information to be able to make those claims at the time. So there was this use of data for quite nefarious purposes. There was the use of information to pursue other agendas, and that was very much what was happening within the metropolitan level at the time. So what are the conclusions? Well, on the one hand, the metropolitan level offers a great hope for breaking through silos and working transversally, which is a big issue that we see within the South African government. We see that this is certainly trying to bring people together. The kind of functionality and the functional nature of the city region has certainly been brought to the fore, certainly been something that needed to be considered and has been, without question, driven by the COVID pandemic. But it has its limits. And that's certainly that politics always get in the way and need to be considered. The existing fault lines don't go away just because we want to claim some kind of metropolitan government. They might get worse. And we rather need to think through an appropriate distribution of responsibilities. Local government is better at some things. They are closer to communities. They are closer to what is happening on the ground. They do know what's going on. And also we need to think about and understand the connections with the parts of government and think through how to pursue a robust kind of cooperative governance structure. Okay, I think I went really fast, and between talking fast and my accent, I hope you understood anything at all, but thank you very much.
Thanks, Margot, for talking so fast and so intelligently about those issues. That concludes the 4 papers that we are hearing in this webinar, and now we can look forward to 2 short commentaries that we hope will help us to also bring things together and make sense of it before, if we have time, we open it up to Q&A. And yes, Joe Mihevik, I have heard you. I see your question. You will be the first one on if you're still part of the audience. So our first commentary is Neil Brenner, who previously served as the professor of urban theory at Harvard's Graduate School of Design and as professor of sociology and metropolitan studies at New York University, one of the hosts of today's webinar, but now is Lucy Flower Professor of Urban Sociology at the University of Chicago. Neil is a critical urban theorist, sociologist, geographer who is interested in all aspects of research on cities and urbanization within the social sciences, the environmental humanities, the design disciplines, and environmental studies. Neil's writing and teaching focus on the theoretical, conceptual, methodological dimensions of urban questions and on the challenges of reinventing our approach to urbanization in relation to the crises, contradictions, and struggles of our time. His current work is focused on the question of how hinterlands, the non-city territories, infrastructures, and ecologies that support urban life have been remade under the Capitalocene, the age of capital. Brenner's most recent books are New Urban Spaces and Critique of Urbanization, as well as the edited volume Implosions, Explosions. And for completeness sake, because I mentioned my collaboration with Xu Fei, Neil also co-edited the original Global Cities Reader with me in 2006 and has been one of the leading urban theorists of the past 20 years. Neil.
Roger, thank you for that very generous introduction. I am aware that we are under time pressure because we do want to open this up to questions from the panel. So I'm going to try to be extremely brief. Let me express my appreciation to the panelists for your fascinating and extremely informative analyses of the governance challenges and transformations associated with this pandemic in a number of major urban regions around the world. Solly gave us a fascinating account of the centrality of metropolitan regions to disease transmission, and made a very strong case for the sort of functional importance of metropolitan regions in the US context. Xu Fei gave us a fascinating account of what's been going on in Wuhan since the onset of the pandemic and the ways in which the specific territorial form of urban governance in China and specifically in Wuhan engendered a particular kind of response, in retrospect, very effective in the sense that the pandemic has been more or less contained and that we're now in a post-pandemic moment. Eric gave us a fascinating account of the complex disjunctures between functional and jurisdictional space within the Paris metropolitan region. That's a fundamental issue, of course, in many parts of the world. And then Margot gave us a really incredibly detailed and wide-ranging account of the collision, among other things, the collision, as it were, between inherited governance arrangements, the pandemic, and the really brutal geographies of inequality across the broader Gauteng region. So I've got a couple questions and one observation. I'll try to make it pretty quick. I mean, the first one is just basically, I'm really interested in situating urban governance and local governance within broader geographies of state power. So in other words, multi-scalar geographies. So for me, the local and the metropolitan are always embedded within multi-scalar governance configurations. And I'm sure the panel would agree with that proposition methodologically, but I think it's quite relevant here. I mean, I certainly agree with the proposition, the organizing proposition of the panel, that metropolitan governance is really important. I think all of us would make that argument pre-pandemic, and we're obviously all making that argument now. So I don't disagree. But to some degree, I would hypothesize, and again, it's a theoretical proposition, but it's also one that requires empirical explication. I would hypothesize that the most important scale in some ways, conditioning the different responses that we've heard about this morning, is really the national. So again, it's not an either or. The metropolitan itself, the local, is embedded within a national context. But it's also, we must emphasize, a restructured national configuration of state power. So again, depending on the context, but to make some broad generalizations, there's a lot of scholarship, of course, that has argued that during the last 40, 50 years, there's been a major reorganization of state power worldwide in the context of the crisis of national developmentalist, Fordist Keynesian capitalism. And in the Chinese context, the rise of a certain liberalized formation of Chinese state power in the context of the entry of the Chinese economy into the joining of the WTO and really embedding in the world market. So there are major reorganizations of state power that involve changes in the way states govern social reproduction and changes in the way states promote economic development at various scales, which also position municipalities and localities in particularly strategic ways. So it's just simply a suggestion that we embed this conversation also in relation to those broader scales. So that's one kind of question and observation for the group, both the panel, but also our listeners today. Second observation and also question is really, I just want us to think about, this wasn't really the focus of today's panel, but I just think it's really important to pose some questions about what are the implications of these regulatory experiments that we're seeing amidst the pandemic for longer term patterns and pathways of urban governance. I just think it's really politically important to talk about this. We're basically seeing a kind of, it's an emergency. And there are lots of emergencies in the history of capitalism, and certainly in the context of, the ongoing climate emergencies in the plural, we're going to see that, this unfortunately is likely not going to be a unique crisis. There are many emergencies coming related to the pandemic and other emergencies related to the ongoing crisis of the Earth system. So emergency urban governance, I put it in quotation marks. I don't know if that's a thing or whether that should be a concept, but in a certain way, we're seeing this accelerated rollout of crisis management strategies in the context of just devastating economic and social crisis and death. And so it's a kind of just-in-time approach to regulatory experimentation, of course, building upon inherited strategies and institutional arrangements, but also in this accelerated context, there are certain changes that are being implemented outside whatever normal channels of legitimation and policy implementation are. So I just think there are a lot of implications we need to think about. A number of panelists mentioned the expansion of surveillance through digital media in the context of the pandemic. This may have potential benefits for public health, but it also, obviously, as Shufei mentioned, it has serious dangers for public life, democracy that we need to mention. There are questions about the particular contradictions between priorities such as economic growth or capital accumulation and supporting social reproduction and public health. And that contradiction is playing out in brutal ways everywhere in the world. And we need to have public conversations. We need to have scholarly discourse about how to think about these issues. The real burden of survival in the midst of this pandemic is being imposed on marginalized populations, often racialized populations. So the burden that the system of urban governance is, the way that the system of urban governance is managing this crisis is in a certain way intensifying a certain model of class and racial exploitation that again exists in different parts of the world in different ways. But we need to talk about the ways in which these geographies of inequality are actually being exacerbated by current urban governance arrangements, including in the context of these emergencies. So, and then the last point I want to make, it goes a little bit outside of what the panelists spoke about, but it connects up with some of Roger Kyle's very interesting and important framing remarks about extended urbanization, which is something I'm also very concerned about and very interested in. And I just want to make the observation that in talking about the governance of this pandemic, we certainly need to continue to deal with what happens with this pandemic after, as it were, the moment of zoonosis, after the moment when the pathogen jumps from a non-human species to the human world and then circulates through the global urban system. That's obviously important, and that's what we've been focusing on. But in many ways, if we want to look for structural causes of this pandemic and other emergent infectious diseases, we need to deal with the ways in which capitalism and capitalist agriculture in particular has transformed the non-human world in ways that are bringing pathogens in much more immediate context to, in much more immediate proximity to human beings. So questions about, and large human populations, questions about deforestation, questions about the commercialization of wildlife, questions about industrial livestock production around the world, and the ways in which these land use practices and their ecologies are creating an extremely dangerous planetary configuration that, that is really moving pathogens that were previously relatively localized and insulated within relatively remote forests and other ecologies into much more immediate proximity to human life. So that question about root causes is something that I think is really important. And there are governance questions about that, which are highly relevant to this panel. In other words, if you take an analogy from fighting forest fires, so yes, there's a question of how do you manage the fire once it's exploded into particular forests, but there's also a whole question of how do you actually manage forests in order to limit and localize fire damage. And so we can use that as sort of we can think of that as a metaphor in relation to emergent infectious diseases. And there are governance problems that go beyond simply the urban, but go to the governance of, again, to use the term that Roger brought in, extended urbanization that take us into that realm. And I think that also needs to be on the table. So I'm at almost exactly 10 minutes. So I'm obliged to stop there and again, reiterate my thanks to the panel and to the organizers for this conversation. Thank you very much.
Thanks so much, Neil. Big questions. We won't be able to answer them here, but we have one more commentator. I make it quick with the introduction. Rachel, who came to us through a mutual friend, David Miller, who is the former mayor of Toronto, one of her colleagues. Rachel is the Director of Knowledge and Learning, responsible for C40's, the network's knowledge management strategy and research program. Rachel, if you could speak for a few minutes about your perspective from the network, and please hand it back to me. Give me 2 minutes to conclude this, and I want to give the last word to Solly before we close down, because we have a hard stop at 12:30. Thank you.
Absolutely. I'll keep it very brief. Again, thanks for having me. It's been really interesting to listen to everyone's perspectives on this. I wanted to just share some of the things that struck me about the parallels between the health crisis and the climate crisis that we're facing. And I'll kind of keep them very brief. So apologies if they're a bit too superficial. But, you know, I was really struck by the comments from the speakers about the urban areas and how vulnerable they are to sort of shocks. We see that in the health world, we see that in the climate world, and how urban areas are kind of hit first as the canaries in the mine, if you like. And I was again sort of struck about the preparedness and how important that is from both a kind of pandemic and the climate perspective. I think from our perspective in the climate world, the kind of fact that the pandemic has really highlighted the interconnectedness and the inequity that we see globally, and particularly in urban areas, has been very interesting. It's something we focus on a lot in climate change, looking at the cascading risks that can occur and some of the challenges to those around governance and data that we've heard about again from the speakers today. And inequity, I mean, I don't really need to add any more on that, but how important that is. And that's something that kind of we're increasingly looking at from a climate perspective. We really can't solve climate change without properly kind of thinking about equity. So that was, yeah, that was a kind of sort of second observation. Thirdly, you know, none of these problems conveniently observe boundaries or respect boundaries, and how kind of the difference between functional areas, metropolitan areas, and our institutional and our governance, and kind of some of the challenges around the inertia of those institutions, and how we need to be kind of innovative in how we govern in order to kind of deal with these crises, as well as in the climate field. You often talk about sort of very technical, practical solutions, but actually we really need to see institutional governance solutions as well. Just the mass transit and the density challenges, that really resonated with what we're facing kind of in the climate world, how important transport is, how important density is, and how under threat they are. Oh, sorry, Roger, you're coming in. Okay, and yeah, just a couple of comments about cities and the economic trade-offs that we've had to make with health, and that we continually have to make with climate, and how we have to manage those. I'd agree with the panelists. I don't think there is a silver bullet in terms of the level. Well, I'd agree with much of what I've heard from the panelists. I don't think there's a silver bullet in terms of cities. And I do think there's something interesting about the new role of urban governance, and how we're going to see that happening kind of perhaps transnationally, internationally as well. Sorry, Roger, I'll stop there.
Thanks so much, Rachel. I'm sorry to putting so much time pressure on you. For me, it's just to say thanks again to all the panelists and the commentators, to the audience, and to apologize for not being able to get to your questions. I really appreciate everybody's interest in this topic. I'm sure more will be coming from this group, but also from everybody who's listened. Solly, you have the last word. Thank you very much. You're muted, Solly.
Thank you, Roger. I want to thank the panelists and the rapporteurs and for their wonderful presentations. They were very instructive for me, and for all the participants for joining in. The way I'm looking at this, and I think Margot's presentation made it clearest, is that we were caught unprepared for this, and we have to be better prepared for the next one. And to be better prepared, we have to ask ourselves, what are the forms of governments that can do things best? And it doesn't mean to me shifting power from the state or to the state or to the, but it means to me like that there is a way of doing the right thing, and that this seminar is the beginning for me of the thinking of how to prepare for the next pandemic. This one is already with us, there's very little that we can do in terms of governance, but there is much to do in terms of putting our heads together and saying to ourselves, this will recur. This will come again. What are the lessons that we need to learn here to do it better next time? So this would be my final word on this. Thank you again, everybody, for putting the effort to participate and to come and join us today. Thank you.